And actually, you're getting your values. Your first time, you can just do a generic value where you're basing it on the patient's age, height, and gender. And each peak flow meter is going to have their own, like their own little graph or scale to do your initial. This is for your, that would be for your initial peak flow instruction. The best values are the ones when your asthma patient has no symptoms and is in good control. Their asthma's in good control and they have no symptoms. That's the best time to get their normal peak flow value. Reading results. So you want to, when you're having the patient do the peak flow, you want to get the best of 3 readings. So there's several different ones. We have this one here. We also have this one here. And this peak flows are nice because it kind of allows the patient to self-monitor, or if you're a parent, it gives you peace of mind, you know, where your kid's at with the peak flow. This is the green zone. Green zone is 80 to 100% of normal peak flow. That means you're in good control. So whatever number you get, that's ideal for your patient. That's the green one, and that's 80 to 100%. So say your patient's normal is 400, you'll set this right about 400 here. That's the green one. That means they're in good control.
That needs to be told, or doctor knows what will be your...
This is a healthcare provider, like as a respiratory therapist in the hospital, we will give the patient their predicted, it's usually a generic because we're seeing them in the hospital, giving it to them for the first time. And they probably can notice, like it's usually the patient will do it at home, whatever their best one, like if you're seeing the patient at home, it doesn't have to be a doctor to do it.
No, but it's only recommended, or at least we were instructed that way. It's only recommended after they do the initial testing with a peak flow meter at the hospital or at the doctor's office. So they'll have an idea of what their quote normal is. And then their normal depends on the height, the weight, and the age of the patient.
And actually, yeah, that's for the generic. But the real good one is just the one that they're able to do when they have no asthma control. Control. Yellow zone is 50 to 80% of normal. This means caution. You're having some narrowing of the airways. You might need some additional medication. Usually I'll tell the patient, if you get into the yellow zone, you need to slow down what you're doing. This is where you need an asthma action plan. I'll tell you exactly what you're supposed to do. You're in the yellow zone, slow down, stop running around, sit down on the couch, relax, take your breathing treatment, and in an hour do another peak flow. If you're still in the yellow zone, you're not in the red zone, or not in the green zone yet, you probably need to make a call to your doctor. Maybe you need some other medications or something's going on. If you are in the red zone,
you better be in the hospital by then.
Red zone is a medical emergency. And again, remember, this is dependent on patient technique and effort. So you have to realize, okay, your kid didn't do it right, or it's not good effort. You need to look at the patient. You can tell if they're really in bad shape by the way they look. So 50% of normal, this is severe airway narrowing, immediate immediate actions needed. They need to have their action plan. They need to know what to do. Take breathing treatment, increase the dose, call the ER, go to the ER, or call your doctor. It's a medical emergency. That brings us to the asthma action plan. This is the new 2007 guidelines is really recommended that we all do asthma action plans for our asthmatic patients. It's one of the most effective asthma interventions available right now. And what it basically is, it's a reminder of the discussion that you had with your doctor about your asthma. Because this is an individual plan based on what your symptoms are, what your triggers are. And so you know what to do if you run into trouble, like that girl that overdosed on her Advil. She needed an action. And she would have been able to see, okay, her controller medications, how much she takes, how often, and what she needs to know, rinse her mouth, whatever, after the treatment. And then it tells you what to do if you need a quick relief. Tells you what to do when you're in the green zone. Tells you what to do when you're in the yellow zone. Tells you what to do when you're in the red zone. And it also lists what symptoms you'll be experiencing in these zones.
Toy.
Yeah.
Sorry, I'm trying to get your name right. That asthma plan, is that in the workbook here? Training.
You're going to be checked out on that.
Oh, okay.
And if you can just please hold the questions for the end,
Oh, okay.
that's great. I have something over the speaker, so we appreciate your So the asthma action plan needs to have a written format. It needs to be written out like this. It needs to be a paper the patient can look at. It needs to be individually prescribed. You can't just have some generic action plan and be handed out to everybody.
That's
Because
right.
everybody's symptoms are different. They're on different medications, different scenarios. Each one is individual.
And it's also recommended that they take the measurement at the same time every day,
Yes.
so that, you'll get a better result that way.
Yeah, and then also if you're feeling that you're having trouble, feeling symptoms, maybe do one just to see where you're at, and that can help you monitor what's going on.
And this is very important to let the parents know that when they have an asthmatic child, you must ask for that so that nurses
You need
and
to, encourage the doctor, your pediatrician.
Yes.
Encourage them to do it, and maybe they're like, what? I don't know what an action plan is.
Yeah, but
Well, you need-
they should
they
have
need to
one.
know.
Yeah, but they usually don't know.
because that's the promotoras when you go, that's when we ask them for their applicants and they don't know nothing about it.
Another important thing with the asthma action plan, it needs to contain info that patients should recognize their symptoms, the exacerbations. Are they wheezing? They have a tight chest? Are they waking up at night? They need to know what are these symptoms? What am I going to be feeling? And then what to do. And then it needs to contain information on what action's going to be taken. So this is what you're feeling. This is where you're at. This is what you need to do. Straightforward. And this will reduce emergency room visits. A lot of times we get patients in the ER, they could have been treated at home probably. They just needed an extra dose of their
Medicine.
quick release medicine maybe. They didn't, the parents didn't know. Should I give them? I just gave them one, 2 hours ago. It should, I can't give them another. We better go to ER, So that'll reduce that. If you know how to control it, you will be less work loss, less school loss. It's very important tool.
Yeah.
And then finally, you're probably going to see more of these vehicles on the road because the gas prices show how soon it's going to be their price make a mistake. This is that one. Okay, thank you.